Did you know 1 in every 4 women regret their choice of birth control within 1 year? Hi guys, my name is Nasteri and I've helped hundreds of moms like you to avoid side effects and to pick the best or the most amazing or the best birth control option for themselves. So stick around because by the end of this video, you're gonna know how to choose or how to pick the best option for you based on your body and also based on your lifestyle. So let's dive in. So guys, so today we are breaking down 7 contraceptive methods, hormonal, non-hormonal, and even the newest option that has just come in this year. So I'll share the pros and the cons and what I tell my patients when they come to see me regarding how to choose a birth control method. Plus, stick around for a free cheat sheet that compares all the 7 methods so that you can even be able to look at it and be able to download and make an informed choice. So guys, before we go into each method, I want us to look at these questions, because if you don't ask yourself and also ask your healthcare provider these questions, then you're definitely not going to be able to pick the right contraceptive method. And what are these questions? Now, question number 1 is, how long do you want this birth control method? Do you want it to protect you or to prevent pregnancy for a few months, or is it 1 year, is it 3 years, is it 5 years, is it 10 years, or even is it permanent? You want, so can you first of all write this question down, because that is the very first thing that you need to tell your healthcare provider. I need a birth control method that will protect me for X number of years. Because if you don't know that, because we have short-term methods, we have medium-term methods, and we even have long-term and permanent methods. So that is the very first step, that is the very first question that needs to be addressed. And then question number 2 is your medical history, because there are some methods that you cannot use and others that you can use. For example, a person who has maybe problems like blood clotting issues. For example, you have deep venous thrombosis, or maybe you have maybe some certain cancers, for example breast cancer, you have maybe hypertension, diabetes, then definitely there are some methods. For example, you cannot use the pill. So your medical history, your healthcare professional has to go through your medical history. And if you just visit a healthcare center or a healthcare facility and you just tell your healthcare provider you need a birth control method, and you pick one and they just give you without asking these really important questions, then you should not, because it can, the risk may outweigh the benefit. That is what I actually mean. So your personal medical history is so important. How is your health? How is your obstetric history here, as we're going to talk about this? Because if you have maybe issues, for example, an irregular cycle, you may need a different birth control method as compared to a person who has no issues with their menstrual cycle. Also, another thing is, what is your history of contraception use? Like, how has it been? Have you ever used a birth control method before? How was it? For example, you used the daily pill. How was it? You used the injection. How was it? Because sometimes, depending on what is in the birth control method, if you pick another method with the same ingredients, then you may tend to suffer the same side effects that you are actually running from. So history of contraception use, I know I've explained that. And then another one that is so important is, when do you plan on having a baby? Because some of these methods, as we are going to talk about, some of them, yes, when you withdraw from them, your fertility may return immediately, but there are some others that delay return to your fertility. So this is so important, because it will help you pick a method that is convenient for you when you want to conceive, so that you can conceive immediately. And it will also help you to choose between a short term or a medium term, a long term, or even a permanent method. So that is so important, and these 5 questions have to be addressed when you are picking your birth control option. So that is where I wanted us to begin. And now let us just go through the various birth control options that are out there for you. And we are not going to talk about the contraindications, because I've told you that your personal medical history, you have to go through, you and your healthcare provider have to go through your personal medical history, so that they can decide which method is good for you, which one is not good for you, depending on your medical history. So let us now dive into the methods. So let us talk about the birth control pills. I know you've heard them. There's this one, progestin only pill, and there's also this one. I don't have it physically, the combined oral pill. So the difference is that this one has both has progestin only. This one has 2 hormones, that is estrogen and progestin. So how do these work? How do pills work? So they mostly work by inhibiting the hormones that are responsible for ovulation, and by so doing you will not ovulate. And you know that if you're not ovulating, then you're not fertile. Another way how they work is that they thicken your cervical mucus, making it very impossible for the sperm to penetrate. And then what are some of the cons? The cons of using the pill is that you have to remember to take it at the same time every day. I've seen a lot of ladies come and tell me, I forgot to take my pill for 2 days. What do I do? And maybe I've taken my pill for 5 days. I forgot for another 5 days. What am I going to do? Or I've skipped it for 1 day. What am I going to do? So the cons is that when you keep skipping, the effectiveness reduces, and that means you may get pregnant, may not protect you as it should. So so the cons are it requires daily adherence. It may cause side effects. For example, there are some ladies who say they are experiencing some mood swings, nausea, and others say there's some weight changes, for example, weight loss, weight gain, but this is relative. It is not common for all. So that is the birth control pills. Next, let us talk about the IUD. So this is how it looks. And the IUD is of 2 types. So this is the copper IUD. As you can see, it has some copper. You can see it. I don't know whether you can see it, but this is how it looks. So we have the applicator in here. So it's not like this whole thing is going to be. Let me just remove it so that we can have a look at it properly. So guys, so this is it. This is the copper IUD, and this is how it looks like. And then this is just the tools to help push it. So as you can see, guys, this is how it looks. That's why it's called a copper T, because it looks like a letter T. So this one is a long-term method. It can stay in place for up to 10 years, but I always say it's always good to change it after every maybe 3 years, 5 years, 8 years, so that it may not stay in there for too long, but it's effective for up to 99%, as they say. And then it's a long-term method. So if you don't want to have a baby in the near future, the IUD is a good choice. So what are some of the side effects of the IUD? So one of the side effects, especially of the copper one, is that your periods may tend to become heavier. So if for example you are using maybe just 1 pad a day, you may find yourself using 2 or 3 pads in a day, especially for the first 6 months. Yeah, so that is one of the side effects. And then the cramping may get even more, so you may have a lot of cramping during your period. So that is a side effect of the copper IUD. We also have a hormonal IUD. So this is non-hormonal. Then we also have a hormonal one. So the hormonal one has the hormone progestin, and it works like for example, by thickening your cervical mucus, thinning your uterine wall, so that a fertilized egg cannot really implant in there, and also by inhibiting your ovulation, so you're not ovulating. This one is normally inserted in your uterus. It has to be inserted by an experienced healthcare professional, so you cannot do it at home or tell your partner to insert it, because there are some measurements that we normally have to do. So this one is inserted in your uterus. And another thing, during insertion you may feel some form of discomfort but not pain, and this whole process takes about maybe just 5 to 10 minutes max. So you'll just have some discomfort when during insertion, but not pain. So the side effects are disrupting your menstrual cycle. For example, you may not have a period, or you may spot every now and then. So that is a side effect, and that is the difference between the two. So these the hormonal IUD has hormones. This one does not have any hormones, but they are both long-term methods. So I hope you've understood that. And then let us talk about implants. So this is the Jadel, but nowadays you may find mostly they're just coming in one rod, not two rods. So for this one, you may have one that can prevent pregnancy for up to 5 years, and there's one that can protect from pregnancy for just 3 years. So this one, let me just remove it once again so that you can see how it looks like. Okay, so this is how the rods look like. You may just have one inserted, and they're normally inserted on your arm, just under the skin. So if you have one, you can be able just to feel it, so because it is normally inserted in there. So these ones just have one hormone, progestin, and they work by thickening your cervical mucus, thinning your uterine wall, making it very hard for fertilized egg to implant, that is for blastocyst to implant. And then the side effect is as I've explained. So that is the implant, and it's also a long-term method between 3 years to 5 years. Another method that I want us to talk about is a short-term method, condoms. So this is a female condom. If you've never seen a female condom before, so we have male condoms and we also have female condoms. So we normally say that condoms offer a dual protection. So by dual protection, we mean they protect from STIs and also from pregnancy, as compared to all of these other methods. All of these other methods do not protect from STIs and pregnancy. They only protect from pregnancy, but condoms protect from both STIs and also from pregnancy. So you have to learn how to use a condom, and the effectiveness of a female condom is around 70, 75%, 79%, thereby, because a lot of women do not even know how to use it, and you have to insert it, and it has to stay in your body for up to 8 hours before you can have intercourse with somebody. So this one requires some bit of patience, and it's not for everybody. So I don't feel like opening it up because it has a lot of, but anyway, let's just open it up and see how it looks like. And then so guys, so this is the female condom. So this is how it looks like. Look, see. So this is how it looks like. So this is the outer, and then this is where you insert it. So you just fold it like a letter number 8, and then insert it when you're squatting, and then it has to go in and leave this room. So this is where the male is going to enter through. So if you don't insert it properly, and maybe this one just folds inside your vagina, then you're not going to experience any benefits. Like, for example, it can get lost inside, and you can also get pregnant. So this is what I didn't want. So those are the condoms. So they offer dual protection. And there is also the natural or the calendar method, which is natural. For this one, I would like to do like a whole video on its own because it is so detailed. But I also say it is the best method because that is what God wanted us to use. It has zero side effects, but it also requires a lot of accountability from both you and your partner. So allow me to talk about the calendar method on one video on its own because this one is detailed and I cannot just go through it in combination with this other method because there is so much that goes in there. So there is also this other method that I've not talked about, that is the 3-monthly injection. So the 3-monthly injection contains the hormone progestin, and this one you get one injection after every 3 months, and the side effects are, for example, interferences with your menstrual cycle. For example, your periods disappear or you bleed a lot. Yeah, but mostly it disappears. Another one is, I've seen some women complain of weight loss, others have complained of weight gain, others have complained of mood changes. So all of these are as a result of the uh, the hormonal effects. But one thing that I would want to mention is that for fertility returning with the injection, it may take some time. Yes, for some women, the fertility may return after 6 months, but I've also seen others who have been trying to conceive even 5 years after using this method and they are yet to conceive. So if you are not yet done with trying to conceive, I would advise you don't use the injection because of the delay in return to fertility. I'm not saying it makes you infertile, really, no, but it may delay return to your fertility from 6 months to 1 year and even beyond. It just depends with your body. So for implants, for IUDs, the return to fertility is almost immediately, and also for the pill, when you stop taking them, your cycle will start coming back to normal after a very short period of time. So the injection is the only one that may delay your fertility for between 6 months to 1 year and even beyond. So it is always good to take that into consideration when you're choosing this method and when you are answering the 5 questions that we've talked about. My own opinion, if you're not married, I would advise the best contraception to use is abstinence, because sex on its own it's a huge responsibility, and if you can control your body and wait until you're married, then this can save you a lot of stress, a lot of other many spiritual and physical things that you didn't even have to go through. So abstinence is the best contraception for people who are not yet married. So I'm one of those who advocate for till marriage, because that is the best option. Really, you will have no stress at all, and then even if you break up with somebody, they will not carry a part of you, because actually sex bonds two people. It kind of glues two people together, and when you break up, it's kind of it leaves a wound. So if you're not married, just keep yourself whole. Don't let another person steal a part of you because you could not have waited. So abstinence is the best contraception for unmarried people. But if you're married, or then you have the option of choosing all of those other methods that we've talked about. So if you want all of these methods compared in a cheat sheet, check the link in the video description so that you can get yours. So that there are also others that we've not talked about, for example, spermicides, for example, diaphragms, for example, the patches. I've just talked about the very most common ones. So there are those lesser ones, but I've included them in the cheat sheet that you can actually just download it so that you can go through it, check it yourself, and compare all the methods side by side so that you can be able to make an informed decision.